it, but not putting it. All right, so this is cervical traction. That's what we're going to do next. All right. The first thing to remember is this little doohickey spins. You want it to be like this. Goes in and locks down. Yeah, that's not right. Why is that thing making a noise? It's still not right. That's still not right. Still not right. Why isn't it going in? It just went in a minute ago. Oh, don't worry, I'll edit this out. There it goes. Okay, in like that. Okay. So, oftentimes what you'll see is someone putting a hot pack down for the patient before the treatment. So we'll go ahead and simulate that today. I have a hot pack in here, and I have 2, 4, 6, I have 8 layers. All right, Kendra, go ahead and lay down, and you want your head on the pad. Scoot up. You want your hair, you probably want your hair above. She has a long ponytail. Earrings, glasses, dentures, all have to be removed. Hair needs to be made sure it doesn't get stuck in the moving components. Okay, do you feel like you could scoot up just a little bit more? Good. Okay, so we're going to put the strap over her forehead, and we want it to be nice and snug. How's that feel?
That's fine.
Okay, now we're going to use the knob here on the side, and we're going to tighten this up until it feels snug against the base of the patient's head. So we're looking for some input from the patient. Tell me when that feels good and snug around your neck or head. Good. Good? All right. For the lower half, the patient should just be comfortable, okay? If she wants her feet up, that's great. If you want to prop her with some pillows, that's great. No problem there.
You comfortable? I'm comfy.
We're going to give the patient the kill switch, just in case she doesn't like what's going on. Okay. Next thing we're going to do, we're going to release the rope and hook her up. For this, it hooks right here. Just like that. Take the tension away. Good. Okay. So for this machine, we're going to do a joint distraction again. Joint distraction is 20 to 29 pounds of pull. But before you do the pull or get everything started on the screen, you need to make sure that the angle of pull is correct. Okay. The angle of pull should be between 25 and 35 degrees. So I'm going to measure. I'm going to use the bed as my perpendicular. I'm going to line up my fulcrum here, or my axis here, and my fulcrum with this line here. All right. And we are at about 20 degrees. So we need to be a little bit bigger angle than that. So I'm going to lower the table a little bit. We're at just about 25. Let's give it a little bit lower. That looks good. Okay. All right. How do you feel?
Fine.
Are you comfortable?
Yep.
Any pain?
Yep.
How's the heat on your back?
Feels pretty good.
It feels good. Okay. So now we're going to get the machine started. I kind of already set it up. We're going to do a hold time of 15 on and 15 off. I've already got it set for 29 max and 20 min. All right, her rope's good. There's very little to no slack in it. Again, we've set it for about 25 minutes because we were going to have it ramp up, hold, and then ramp down. And all we're going to do is hit start. Now, you can see this is pulling here. The traction meter is at 10 pounds right now. It's going to hold her there for about 15. Okay, relax. Then it's going to pull up to about 20 next. How does it feel?
Fine.
Can you feel it pulling?
Mm-hmm.
Is it pulling on kind of the base of your head?
Mm-hmm.
All right. Any pain anywhere or any new pains anywhere?
Nope.
Okay. Holding here. Now the next pull is going to be all the way to the max pull at 29 pounds, which would be that joint distraction level. Here it comes. Here comes the 29 pounds. There you go. 29 pounds. We're going to hold for 15. How do you feel?
Fine.
Can you feel the pull?
Mm-hmm.
What does it feel like?
Like someone's pulling my skull off my neck.
Okay. Can you feel the soft tissue stretching in the back of your head and your neck, maybe down your spine?
Yep.
Okay. Now it's going to release to about 20 pounds of pressure for about 15 seconds, and then it's going to pull again at the 29 pounds. How's it feel?
Fine.
Can you feel it pull and then relax and then pull and then relax?
Mm-hmm.
Is it comfortable?
Mm-hmm.
All right. Okay. So that is cervical traction. When your patients get up from these, either one, lumbar or cervical traction, you're always going to want to make sure that they get up slowly. You're right with them at their side because they become dizzy or lightheaded. Oftentimes we'll have them rest in the supine position for a couple minutes before we ask them to get up, and we'll assist.